self-esteem and independence. When should I consult a speech therapist? When your child isn't speaking, when your child is stuttering, your child doesn't engage in group play, doesn't want to play with the group, prefers to play alone. Child's voice is hoarse or shrilly. So if you see any difficulties with his pitch, loudness, quality, there's no harm in visiting a speech therapist. Child's speech is unclear. Child has a cleft of lip or cleft of palate. What is cleft of palate? When there is a hole in the palate when the child is born. Any child with autism, Down syndrome, cerebral palsy, is a late talker, apraxia, learning disability, hearing impairment would need the help of a speech language pathologist. Okay, some other symptoms again that I have listed down for you. The child struggles to imitate the sounds that you ask. For example, you're saying, say R, say R. The child is trying, but is not able to say. And you're like, he doesn't get it only. He doesn't, because some children are not able to understand what is the correct placement. How are they supposed to put their tongue? How much pressure they have to apply. So you can't just expect them to just copy me, say R, say R. You need to see a speech therapist. We have different techniques that we can help the child learn and say those sounds. Because after you ask them to say R and they see they're not able to do it, when they come to us in speech therapy, they've already given up. They're like, I can't do it. I've tried it with my mom. I've tried it with my dad. I just can't do it. Right? We don't want them to lose hope. We don't want them to give up on that. So just follow your gut, listen to your gut. If you feel that, okay, my child is having difficulty with this and I think I'm not able to help them, there's no harm in visiting a speech therapist and taking their opinion on this. Child shows a slow, for example, you gave an instruction and you see that they don't respond immediately, or they're not able to follow the command. They take really long to follow it. Maybe they have auditory processing disorder. Many times APD in India isn't diagnosed only because parents don't pay attention, or they're like, otherwise he seems normal. Maybe he's just slow. Maybe he's like not smart. No, there might be some difficulty there, and this is trainable and the child can improve on this. So these are the small things that you should look for. The child is not able to communicate his basic needs, cannot combine words, has stopped saying sounds or words that he was able to say before. This is a very important complaint, especially in children who are diagnosed with autism later, that he was able to say mama, he was able to say papa before, but now he's just forgotten it. He's not saying it. Okay, please be cognizant of these problems. These are the red flags that you're looking for. Child is not able to start conversations. We just label them as, he's just shy. No, he's not just shy. He just doesn't know how to start a conversation. And then now, because it wasn't worked on, I have 17, 18-year-olds or even college, children like 23, 24-year-olds coming to me. They're like, I just can't make friends in college. I don't know how to talk in a group. I don't know how to. And now they have social anxiety because they found these situations so difficult. They didn't know the rules of a conversation. How do you maintain a conversation? How do you end a conversation? How do you join a group? Okay. Some people don't learn by themselves. They need someone to explicitly teach them, and that's all right. So you need to identify if my child or anyone I know has these difficulties. I should suggest that they get help, they get support for this. Child is not speaking fluently by 3.5. I think when the child is developing language by 3 years of age, they do stutter at times and we find it cute, and that's okay. But even after 3 or 4 years of age, 3.5, I would say, because that's a good age to start. If the child is really repeating a lot of words, getting stuck on it before it becomes a habit for them, I think that's when you should intervene. Okay. Now, how can parents help? As I told you all before, parents, I think I always say this to all my parents who come at Soundrick. you are the best speech therapist for the child. If you really follow what the therapist is teaching in the session, what techniques, what activities they're doing in the session, and following it at home, your child is going to show so much progress and such quick progress. Okay, so it's important that you maintain that dialogue with your therapist, are very aware as to what is going on, what is the therapist doing. Ask them questions. What can I do at home? How can I support my child better? Ask a lot of questions to your speech therapist. Take reports from them. Take progress reports from them. Ask them for a home training plan. If you are not able to take your child for therapy, 2 times a week, 3 times a week, for multiple reasons, get a plan made that you can do at home. Keep taking feedback from the child, from the therapist, that this is what I'm doing and this is how the child is responding. Make videos, send it to the child, send it to the therapist, ask them for the feedback. This is the least that you can do. And parents, please be patient. It takes time. It takes time for the child to show progress, to show this changes. Okay, it's gonna take time. You have to be patient, but please put that time, put that effort, because it's worth it in the end. And if you can involve all family members, I have a child whose whole family is involved, and whatever goal we're working on, the whole family works on it. And we come up with different activities that the grandparents can do, that the uncles and aunts can do, that the cousins can do. It I can't tell you, in 3 months the child has shown so much progress. From no words, now he's speaking in sentences. Okay, so if he has a conducive environment around him, if he's motivated, if the activities are just right for the child, if you're working on the current the right goals for the child, if you have understood what are the challenges that the child is facing, you will see progress. That's there, that's for sure.